Acute myeloid leukemia, or AML, is a type of blood cancer that affects the blood and bone marrow. It starts in the bone marrow, which is the spongy tissue inside bones where blood cells are made. The bone marrow is responsible for producing red blood cells, white blood cells, and platelets. AML causes the bone marrow to produce abnormal white blood cells called myeloblasts. These myeloblasts are immature cells that do not function properly. These cells don't mature properly and can't fight infections effectively. As a result, the body's immune system becomes compromised. In AML, these abnormal cells multiply rapidly. This rapid multiplication leads to an accumulation of myeloblasts in the bone marrow and blood. They crowd out healthy blood cells, leading to a shortage of red blood cells, white blood cells, and platelets. This shortage can cause a variety of symptoms and complications. This shortage disrupts the blood's ability to carry oxygen, fight infections, and control bleeding. Patients may experience fatigue, frequent infections, and easy bruising or bleeding. AML is an aggressive cancer that requires prompt treatment. Early diagnosis and intervention are critical for improving patient outcomes. It can affect people of all ages, though it is more common in adults over 60. However, children and young adults can also be diagnosed with AML. The exact causes of AML are not fully understood, but certain risk factors can increase a person's likelihood of developing the disease. These risk factors can be environmental, genetic, or related to previous medical treatments. These risk factors include exposure to radiation and certain chemicals. For example, long-term exposure to benzene, a chemical found in industrial settings, has been linked to an increased risk of AML. Previous chemotherapy and genetic predisposition can also play a role. Some genetic disorders, such as Down syndrome, are associated with a higher risk of developing AML. Understanding the basics of AML is crucial for early detection, timely treatment, and improved outcomes. Ongoing research and advancements in medical science continue to enhance our knowledge and treatment options for this challenging disease. Acute myeloid leukemia, or AML, symptoms often appear gradually and can mimic other common illnesses, making it challenging to diagnose early. Fatigue is a hallmark symptom, often severe and persistent, leaving patients feeling drained. Patients may experience shortness of breath, especially with physical activity, due to a lack of red blood cells, which are crucial for oxygen transport. Frequent infections, slow wound healing, and fever are common signs of a weakened immune system, as the body struggles to fight off pathogens. Easy bruising or bleeding, including nosebleeds and bleeding gums, can indicate a low platelet count, which is essential for blood clotting. Some individuals may also experience bone pain or discomfort, which can be a result of the bone marrow being overcrowded with abnormal cells. If AML is suspected, a doctor will perform a thorough physical exam and order blood tests to check for abnormalities. A complete blood count, or CBC, can reveal abnormalities in blood cell counts, such as low red blood cells, white blood cells, or platelets. A bone marrow biopsy is usually necessary to confirm the diagnosis. This involves taking a small sample of bone marrow, typically from the hip bone. The sample is then examined under a microscope for leukemia cells, which helps in determining the presence and extent of the disease. Significant progress has been made in treating AML in recent years. New drug combinations and therapies have emerged, offering hope for improved outcomes. One such advancement is the FLAG-GO combination therapy. FLAG-GO combines the chemotherapy regimen FLAG, which includes fludarabine, cytarabine, and G-CSF, with the targeted therapy gemtuzumab ozogamicin. This combination has shown promising results in clinical trials, particularly in patients with a specific subtype of AML called core binding factor AML. Another notable advancement is the use of olutasidenib as a bridge to transplant treatment. For patients with relapsed or refractory AML with an IDH1 mutation, olutasidenib can help control the disease and improve their eligibility for a stem cell transplant, potentially offering a chance for long-term remission. Personalized medicine is revolutionizing AML treatment by tailoring therapies to individual patients based on their unique genetic makeup and disease characteristics. This approach aims to optimize treatment efficacy while minimizing side effects. One example of personalized medicine in AML is the development of predictive algorithms. By analyzing a patient's genetic information and other clinical data, these algorithms can help predict which treatment regimen is most likely to be successful for that individual. Another important aspect of personalized medicine is frailty assessment. Elderly AML patients often have other underlying health conditions that can impact their ability to tolerate intensive chemotherapy. Frailty assessments help identify patients who may benefit from less aggressive treatment approaches. Section 5. Real-world data and treatment outcomes. Real-world data from clinical practice provides valuable insights into the effectiveness and safety of AML treatments in everyday clinical settings. This data complements the findings of clinical trials and helps guide treatment decisions. For instance, real-world studies have demonstrated the efficacy of venetoclax, a BCL2 inhibitor, in combination with hypomethylating agents like azacitidine in elderly AML patients who are not eligible for intensive chemotherapy. These combinations have shown significant improvements in survival rates. Real-world data has also shed light on the use of oral azacitidine as a maintenance therapy after initial treatment. Studies have shown that oral azacitidine maintenance can prolong remission and improve outcomes in certain AML subtypes, particularly those with myelodysplasia-related changes. Section 6. Immunotherapy, a new frontier. Immunotherapy is an innovative approach to cancer treatment that harnesses the body's own immune system to fight cancer cells. This groundbreaking method is revolutionizing the way we think about cancer treatment, offering new hope to patients who may not have responded to traditional therapies. One of the most promising forms of immunotherapy is CAR T-cell therapy. This treatment has shown remarkable promise in treating certain blood cancers, including acute myeloid leukemia, or AML. In CAR T-cell therapy, a patient's T-cells, a type of immune cell, are genetically modified in the laboratory to express chimeric antigen receptors, or CARs, on their surface. This genetic modification is a complex process that involves reprogramming the T-cells to better recognize and attack cancer cells. These CARs are designed to recognize and bind to specific proteins found on the surface of cancer cells. This binding action is crucial as it allows the T-cells to identify and target cancer cells with high precision. Once the modified T-cells are infused back into the patient, they can directly target and destroy cancer cells with enhanced precision and efficacy. This targeted approach minimizes damage to healthy cells, reducing side effects and improving patient outcomes. Clinical trials are ongoing to evaluate the efficacy and safety of CAR T-cell therapy in various AML subtypes. These trials are essential for understanding how this therapy can be optimized and made available to a broader range of patients, potentially transforming the landscape of cancer treatment. Section 7. The Global Clinical Trial Landscape. The global clinical trial landscape for AML is constantly expanding, with numerous ongoing trials evaluating new drugs, drug combinations, and treatment approaches. These trials are essential for advancing our understanding of AML and developing more effective therapies. Molecular studies have played a crucial role in shaping the clinical trial landscape. By identifying specific genetic mutations and molecular pathways involved in AML development, researchers can design targeted therapies that specifically address these abnormalities. The increasing availability of targeted therapies has led to a shift from standardized chemotherapy regimens to more personalized treatment approaches. This trend is reflected in the growing number of clinical trials investigating the efficacy of targeted therapies in various AML subtypes. Section 8. Breakthroughs in drug-resistant AML. Drug resistance remains a significant challenge in AML treatment. Many patients initially respond well to therapy, but eventually relapse due to the development of drug resistance. However, recent breakthroughs offer new hope for overcoming this obstacle. One promising area of research focuses on targeting drug-resistant FLT3 mutations. The FLT3 gene is frequently mutated in AML, and these mutations can drive drug resistance. Researchers are developing new inhibitors that can effectively target these resistant mutations, potentially improving outcomes for patients with FLT3-mutated AML. Another breakthrough involves the development of menin inhibitors. Menin is a protein that plays a crucial role in the survival and proliferation of certain leukemia cells. Ziftomenib, a menin inhibitor, has shown encouraging results in clinical trials, particularly in patients with high-risk AML subtypes. Section 9. Hope for the future. Ongoing research and innovation. The future of AML treatment is filled with hope, driven by ongoing research and innovation. Scientists and clinicians worldwide are working tirelessly to develop new therapies, improve existing treatments, and enhance our understanding of this complex disease. One area of intense research is the development of novel immunotherapies. CAR T-cell therapy continues to show promise, and researchers are exploring new targets and strategies to enhance its efficacy and broaden its applicability to more AML patients. Another exciting avenue of research is the use of artificial intelligence, or AI, and machine learning in AML diagnosis and treatment. AI algorithms can analyze vast amounts of data, identify patterns, and assist clinicians in making more precise diagnoses, predicting treatment responses, and personalizing treatment plans.